predicting a woman's risk for future heart disease could be as straightforward as a single blood test that screens for 3 key risk factors, according to a study published in the New England Journal of Medicine and presented at the European Society of Cardiology, ESC, Congress. The study, involving nearly 30,000 women with an average age of 55, measured 2 types of fat in the bloodstream and a specific protein using a blood test in 1993, and monitored their health over 30 years. Researchers found that the strongest risk predictor was a blood marker of inflammation called high-sensitivity C-reactive protein, hsCRP, followed by LDL cholesterol and lipoprotein, A, or Lp(a). Knowing all 3 predicted risks over 20 to 30 years allows us to target therapies more effectively, said Dr. Paul Ridker, lead study author and director of the Center for Cardiovascular Disease Prevention at Brigham and Women's Hospital. C-reactive protein, CRP, made by the liver, increases with inflammation and high levels suggest an elevated heart disease risk. LDL cholesterol, bad cholesterol, can accumulate in the arteries, raising the chances of heart attack or stroke. Lipoprotein, A, or Lp(a), is a type of LDL cholesterol that also contributes to plaque buildup in arteries. The study revealed that women with the highest levels of LDL cholesterol had a 36% higher risk of heart disease, those with high Lp levels had a 33% increased risk, and those with the highest CRP levels had a 70% greater risk. Women with elevated levels of all 3 markers were 1.5 times more likely to suffer a stroke and over 3 times more likely to develop coronary heart disease. Dr. Ridker noted that while most doctors measure cholesterol, very few measure hsCRP and Lp(a). Doctors won't treat what they don't measure, he emphasized, highlighting the need for new guidelines that include these markers. Ridker recommends that patients request specific measurements of hsCRP and Lp(a) from their doctors, as prevention is most effective when started in one's 30s or 40s. He also emphasized that while lifestyle changes like a healthy diet, exercise, smoking cessation, and stress management are crucial, some patients may need medications to reduce inflammation and cholesterol. The study's primary limitation is that all participants were health professionals, though researchers believe the findings are applicable to men and minority groups, where concerns may be even greater.